The Utah Dog Park is really happy that you guys are all here, and Animal Care Center too. Dr. Tassone is our amazing speaker tonight, but I also have my whole host of other doctors, Dr. Lindsay, Dr. Verona, Dr. Lauren, Dr. Steph tonight. And I'm Dr. Steph is quilting, great. And I'm Dr. Pam. Becky is my general manager, and Julie is my dog park general manager. Generally, if you have a problem or question, one of us can solve your problem anytime, pretty much day or night. But we're really glad that you're here. Dr. Kara is going to talk about itchy dogs, and if you have questions, you can just raise your hand, and Dr. Lindsay is going to be the mic person. She's going to run mics back and forth, and so you can have your questions go on Facebook Live so people can hear those questions. And afterwards, if you liked it, go on and like it on our YouTube or on our Facebook page. We would really appreciate it. And watch our Facebook page because we have really fun events here. Last night we had goat yoga. It was a blast. It was our third time. We're raising money for our We Care Fund charity. It's a great cause, and we're raising a lot every week. So let us know if you're interested in joining. And Dr. Kara is mic'd and ready to go. Thanks again.
How many of you guys know an itchy dog? Just one, maybe two or three. How many of you own an itchy dog? Seriously, miserable, right? Like, itchy dogs are really hard, and they're really frustrating, and they can be so difficult for everyone that has one in their house or knows one watching them sit there miserable. So do all dogs itch? Oh, by the way, happy Easter a couple days ago. So do they? Like, does everybody's dog itch a little? A little. So when I get really worried about itchy dogs is when it disrupts their day. So my dog wandering around sits there and says, I think I'm playing, but oh wait, I got an itch. It's interrupting his normal brain patterns. It's interrupting his thought. It's separating him from what's normal. So dogs shouldn't itch. So why do dogs itch? Common causes. So we see a lot of causes for itch. So I'm going to cover some of the basics and some of the really important ones. So this is where I get my credentials. This is Gooey. Gooey, back corner. This is how I met Gooey at 11 months old. Sorry. He was a euthanasia appointment because he itched so bad. This is why itch is personal to me. This is why I know what you go through every day, having a dog that wants to scratch his face off. And this was my culprit. The primary culprit was Demodex. It's a bug that lives in their skin that they get from their mom. And puppies, when they're exposed at the wrong age, don't form the right immune response to it, so it takes over. Older dogs can get this too. Like we just saw a cute little beagle, 11 years old, miserable, ripping his skin off. He had an underlying disease that made this become apparent as he got older. Miserable, itchy, horrible disease, but treatable if you treat all of the symptoms and causes. This is another cause for itchy dogs. Sarcoptes, or as you've probably heard, mange. It affects humans. It affects dogs. My poor little Dalmatian when I was growing up, my cute little brother's here somewhere, was working at a senior citizen facility and got it from a human. So we don't just share stuff with our dogs. They share stuff like it can go back and forth. Totally treatable if you find it and you test for it. Super itchy dogs. These guys are kind of fascinating though. You touch their little ear and a lot of times they'll just kick. Touch a little ear and they'll kick. It tells us where to look. This is a bugger. This is something we're seeing more and more of as the climate doesn't change. So, totally treatable. Lice is everywhere. It transfers from dog to dog. It's very specific on the species it likes. But when this gets in a population, or your dog passes a dog at the dog park, out on a walk, or wherever, and by the way, our dogs are checked as they come in the door, this can live on their body, and it looks like dandruff. And if you look really closely, it'll look like little clusters of white or brown dandruff down by the base of their hair. Itchy. Awful. All of a sudden the foot's going, they want to claw at themselves, they're uncomfortable. Super treatable. Super treatable. We use a couple of products that help get rid of it and a bath. Like this one. Fleas, ticks, lice, all gone, once a month, chewable, they love it. There are a bunch of easy products to use that help prevent all of these bugs. And we can help you prevent from them. This one is one of the easiest ones to get rid of. Chyletiella. Looks like dandruff, but your dog's itchy. So we know how to check for all of these things. Now there's a bugger. Once in a while we see fleas, and I can almost guarantee that this year in Utah we will see fleas. The climate's different. It's changing. Yeah, we've seen a couple already. So fleas will cause that sudden urge to itch. And they'll chew on themselves. It's not the only cause though. And this dog had a really severe infection to get all of that flea dirt, that brown dandruff all over their skin. So how do we tell? That's the most important thing. What do you want to know that tells us the difference? We have tools. We have microscope slides. We have skin scraping tools where we take samples of the superficial skin. We have this wonderful, magical tool, tape. Super expensive, high tech. We take samples off the superficial skin. All very comfortable versions of testing that can help us determine the differences between all of these disorders. And then we go back, so let me take a step back. Number one and first and foremost is your history. What you know about your dog tells us everything. We can figure out almost all those things with just a simple history and an exam. If you talk to one of our doctors tonight, we can tell you about the differences in where dogs itch because of each different bug. There's actually kind of locations on their body where each bug affects more specifically. And it's not perfect. It's a great start. The tests actually confirm and verify, so we're not testing or treating for things that aren't there. Then we can do the skin scrapes with that cute little instrument. We can do the superficial cytology. And worst case scenario, we can biopsy and take a piece of skin. All great ways to figure out what we're treating and help you get rid of it. Now, one of the hardest things I think for owners to understand is that with all these tests, sometimes we have to do them twice, or sometimes we have to do them 3 times. But it's always warranted because, you know, I had a case of skin mites about 6 months ago on a little dog, but the previous vet had tested it. They'd done all the right things. They thought the dog didn't have skin mites. They put it on a steroid. Perfect. The steroid suppressed the immune system so I could find it and look like the hero. Really, the vet had done all the right tests. We just needed to retest. And that's something super important to understand. So, how do we treat all of these? Every single bug is different, which is why it's so important that we find out what is causing your dog's itch. It also can depend on the severity. If your dog has the same kind of mites that Gooey had, but it has one little spot and it's a puppy, we'll clean it. We'll prevent secondary infections. It'll probably go away on its own. But if your dog looks like Gooey, that's not going to go away on its own. They need systemic treatment to kill off those silly little bugs. Also, if your dog has other illnesses, thyroid disease specifically, Cushing's disease, there's blood work and other testing we can do to find out why this is coming up at that point in life, and if there's other diseases that are affecting it and that could interfere with treatment. And then infection. If they have a secondary infection like Gooey had with pus dripping out of their legs, if you don't treat that, the itch isn't going to go away either. So you have to really hit it from every angle to do it right and to get rid of it. So we see these little buggers also, and these are things that show up on samples from the superficial skin. We see bacteria, we see yeast. Very rarely we'll see fungal infections, but bacteria and yeast can cause sensitivities. Your dog can have a little tiny yeast infection in its ear and its whole body can break out. And yeast sensitivities can be really dramatic. They get naked, they look like an elephant, they want to claw their skin off. Super uncomfortable, but super treatable if we can diagnose the problem correctly and manage it. Bacteria, secondary bacterial infections happen for almost all of the diseases we're talking about tonight. And those secondary infections are really itchy. I think I listened to Dr. Pam when I first started, and she said there's nothing itchier than a staph infection. And like it made her little skin crawl. And she's right, like we treat the underlying infection and the itch will get better. but we have to know that it's there. So, how do we tell? Again, we go back to your history. What's been happening with your dog? How is your dog? What has your dog been doing? Where is it itching? Why is it itching? Is it just ears? Is it belly? Is it feet? And then we take samples. Now, there's also a really nice blood test that can check for an allergic response to bacteria and yeast. And that's a huge component of allergic dogs, because when they're sensitive to those organisms, a tiny little infection will make them go into a full-blown flare, and you'll have a dog that's trying to itch their skin off. It can be pretty miserable. And we want to make them feel better, so knowing that sensitivity is a huge deal. Simple blood test. So treating, we base it on the culture, or we base it on cytology. So what type of bacteria are we seeing? Where are they at? And how severe are they? How has your dog responded to treatment in the past? But a huge part of this that I think sometimes we overlook or gets overlooked is sometimes you have to culture. They can have organisms that are super resistant and may respond at first to an antibiotic, and then they get worse. And then they respond to an antibiotic, and then they get worse. And those guys develop bugs that are resistant to multiple organisms. That's a threat to your patient. It's a threat to yourself. Some of those are communicable. It's really something where we need to get on top of cultures early and find out exactly what we're growing and how to treat it. The other thing is we really rely on you as owners, because as a pet parent, if you don't give that antibiotic as long as we told you and recheck when we asked you to, chances are we're recreating a resistant bug, because it takes a minimum of 3 weeks. Minimum. So the last kiddo I had took 6 weeks to get rid of an infection. And that seems like a long time to be giving a dog an antibiotic. I can guarantee you no one at our hospital will give an antibiotic unless they absolutely think it's warranted. And they'll give it until the condition is gone. We just rely on you to watch the at-home part. Dr. Pam.
I did not culture earlier, Sarah.
I think as a profession, we tend to protect our owners' pocketbooks a little too much, personally. If you have an antibiotic and we make an educated guess and we're wrong, that was a month that your dog was still itchy. In the human world, they culture everything the first time, and if there's no bug there, they won't treat it. Probably where we're moving in the future, but we definitely need to culture more and be more aggressive with cultures. And that's cute, was cute little Tilly, by the way. The other thing dogs can be sensitive to is food. And as you guys know, bulldogs have a ton of sensitivities. They're little money pits themselves. So food's hard. Because your dog's itchy, maybe we all try to blame it on food. And I think it's our tendency to say, okay, well, I changed his bag of food last week and he's itchy now, so I'll change it again this week. But he's itchy again next week, so I'll change it again. That's really not how food works. It can take 6 to 12 weeks to work out of their system. And new food exposure can take time to cause allergic. That is not a dog, but a little comic relief, right? So how do we tell about food allergies? We start with history. Is it year-round? Is it something where there's been a diet change, or even something where we've been on the same diet forever? We look at the patterns on the skin, and we take into account all of the information you give us. And then we can do a couple of different ways to figure it out. So when I had my first Boston Terrier, I did a food trial. I was strict. It was easy. I was the only one feeding him. He did not get any treats. He did not get heartworm prevention. He did not get flavored bones. We went by the book. Everything was that diet only, for treats, for everything. It's a serious deal. If they get a treat in the middle of their food trial, your whole 6 weeks of food just went out the window. Financial expense, time, itchy dog. Sounds pretty miserable. But there's blood testing. Not quite as perfect, but it's a really great place to start. So if you have a little kiddo like I do, I don't know if you guys saw her feeding macaroni and cheese to my itchy dog. She was. Life is complicated. It's really hard to keep dogs away from treats. It's really hard to keep them away from other people. It's really hard to keep them away from matter in the yard. So you have to really take that into account. We have a little naughty yard eater up here. I could never do a food trial on her. It would absolutely take me a blood test to try and figure that out, because it's just life. There's also a saliva test that we can do. So they just chew on a little rope, couple of minutes, get all their saliva on there, and it comes back with their response to different foods. In a perfect world, we'd do all three and figure it out. But I think you have to do what's easiest and most beneficial for your patient. So, and what you can afford, yeah. I mean, money's real. So how do we treat them? This is my little guy that had food allergies. He was on a venison and potato diet. Well, he started on chicken and rice, a chicken and rice-based diet. And over time, eventually his food allergies came back, and we ended up redoing this food trial because they can develop a tolerance or a reaction over time. So with him, he ended up on venison and potato, where he lived for 8 years. It's perfect. He got other things, he was itchy. But I knew that because we did the right testing. The reality of dogs is, though, that they're almost always a combination. It's not always simple. And then you have dogs like Rigby. Rigby's pretty much allergic to life. He's allergic to yeast. He's allergic to bacteria. He's allergic to foods. And now he's got allergies to the world. And allergies to the world, our fancy name for that is atopy. It means that they have sensitivities to multiple things in their environment. So this is the type of testing that Gooey had, my dub-dub back there. He was put under sedation, injected with 72 different things. Allergic to 63 of 72. 63. Humans. Dust. Dust mites, cats, dogs, every pollen, every grass. Yeah. Allergic to everything. Just really allergic to life. So they created his own low dose of each of his allergens that was really affecting him, and we gave them to him for over a year. And that made him manageable with other medications. It wasn't a fix, it wasn't a magic cure, but it made him more manageable and more comfortable. Now they even have drops that you can put in their mouth. Super easy, a lot less stress. Nobody else has to give shots. But you have to do the testing first. So there's skin testing, there's also blood testing. And we have both options available depending on the patient, their stress level. Again, we've got the financial component. In a perfect world, we'd do both and compare them and look at your dog's symptoms and the time of the year that they're super itchy and what seems to be affecting them the most and how they've responded to treatment. It's a huge puzzle we put together. But we have all of those options. How do we treat? So things that they're allergic to in the environment. Being allergic to life sounds really easy to treat. It's not really easy to treat. So dogs absorb a whole bunch of their allergens through their skin. So it sounds easy to say, keep stuff off their skin. Keep life off their skin. Not really easy. So we start with rinses. So rinsing them twice a week just to get the stuff off. Room temperature, you don't want to open pores, you don't want to close pores, you just want them comfortable. Just getting stuff off. We do wipe downs. So a damp cloth, get everything off your body. Just get rid of it. Try and keep it off your skin. We do baths, and baths can be anywhere from twice a week to once a month, depending on your patient. And the shampoo can vary depending on whether they have a secondary infection or whether we're trying to rebuild the surface of the skin. All depends on the patient. Gooey gets his bedding changed twice a week. So I have sheets that I've just laid over his favorite places to sleep. Well, actually, they're fuzzy blankets because he likes those better. Not spoiled. And twice a week I throw them in the laundry. Don't wash them. I just rinse them, getting stuff off of his fur. Springtime's here. He's allergic to grasses. So we start wiping off his feet every time he comes in from outside. Does this sound like a project? Because it's a project. Like, itchy dogs are a huge project. Allergic dogs a huge project. It is the one time I will tell you that clothes can be medically warranted for a dog that I can think of. So you put them in clothing, keep stuff off their skin. So that added layer of protection, so long as you're changing it often and rinsing it out. So then there are products we can use to help support and repair the skin. We used to really think that everything was internal. In the past 5 or 6 years, they've proven that we can actually help the skin barrier from the outside. Fatty acid shampoos, phytostigmine. This product line has been brilliant for itchy dogs. It has in it the building blocks that go between cells and helps hold them together to prevent allergens from coming in. Now, we don't really know if allergies cause the skin barrier to be poor or if the skin barrier was poor and that's what causes allergies. It's kind of a chicken and an egg argument, but we know we can help it. The other ways we can help it is fish oil, which is a couple slides down, but that's an option. Antihistamines. So there are lots of human antihistamines. Some of them are safe for dogs. So I recommend you talk to whoever your provider is about which ones to use. We often use Benadryl and Claritin at the right dose. I find Benadryl to be a bugger because it's 3 times a day, and that's just not compliant with my life. They typically don't cause drowsiness. So I think when you see an itchy dog and it ends up on Benadryl and they're like, oh my gosh, he slept for 3 days. I'm like, yeah, he's been itching for 3 years. He's exhausted. He needs that nap. It probably wasn't the Benadryl. So Benadryl's great. Claritin's great. We have good choices, but every patient's different. Heart patients, we use different antihistamines than other patients. So you really should talk to whoever's providing your care. And then fish oils. So fish oils are a fantastic part of helping protect the body from inflammation. And one of the places they can do that is in the skin. Using the right balance of fish oils is important. So fish oils, there's the EPA portion and the DHA portion. And those 2 portions can compete for different functions. And if you use one that's way off balance, just go grab the cheapest one you can find, sometimes that can do more harm than good. And especially when you're talking joints or skin. Then we have meds. This is a dog named EJ, Dr. Pam knows very well. EJ was on a prednisone spray for years. And Mom thought, oh my goodness, twice a week is great. Every day must be better. So she didn't exactly follow directions, and she sprayed the dog's skin every day, probably multiple times a day, because she was very attentive to EJ. And
this was before the days
this was before, yeah.
of food allergen testing and alcohol type 1.
Yeah. So she got little skin lesions that were little calcium deposits from overusing our medication. That being said, though, prednisone is amazing for itch. It cuts itch lickety-split. They drink a little more, they pee a little more, they might, pant a little more, but for certain patients, it's absolutely the right choice. We also have cyclosporin, so atopica, a nice drug, takes a while to kick in. Makes a few patients nauseous, but for some patients, it's brilliant to control itch. And then in recent years, which is the most amazing thing that's ever happened for GUI as of late, is Apoquel, a pill they take. It tells the immune system's communication system not to produce the chemicals that are associated with itch. Cuts it off. So on a pill that he takes once a day, some patients are twice a day, no more itch. I have to be honest, it's made me a lazy owner. The rinses, the wipes, the baths, they don't happen as often. But man, is he happy. And in long-term studies, Apoquel has very few side effects. Very few. When you talk about drugs that affect the immune system, we're talking about focal drugs. We're not talking about drugs that suppress their whole immune system and make it so they can't fight big infections. We're talking about drugs that cut itch pathways. And most recently, Cytopoint, another brilliant drug. It's a shot. They do it every 4 weeks-ish. Some patients get as much as 3 months. No pills. Same price about as a month of Apoquel. Works similarly, not exactly the same. So we have dogs that can respond better to one or the other. But same idea. It focuses on a really focal or a specific point in the immune system. Cutting itch. Brilliant. Rigby, oh my God, he's a new dog. He did okay on one drug, did amazing on the other. This has saved his little life because he was crazy itchy. I got these out of order somehow, but the other option is desensitization, like I talked about with GUI. Those can be the shots or the oral drops. Most dogs are on them long term. It's not something you do once and then quit. It's something you do for the long haul. I would say at least 1 to 2 years is a good plan. And you expect some response, but not everything doesn't go away. We also have all these topical medications. So you have shampoos, you have wipes, you have drops we can put on their skin and specific sprays. But every patient is so different. It takes really tweaking these and finding the best balance where we can keep them on as few things as possible, but manage their itchy, sensitive skin. So, everyone wants to scratch the itch. You got an itchy dog, they're over there rubbing their back on you, and you reach down and you go, quick, 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 quick. He loves me because I have fingernails, right? You hear that a lot. So what have you just done? Stimulated those cute little nerve fibers that stimulate itch. Just like when I scratch my back and the other side of my back itches. Same thing. We've just caused that dog to be itchier without even knowing it. So when you have an itchy dog, it's very important to massage, not scratch. Sounds trivial, right? Last but not least about itchy dogs, put them in a bubble, right? Don't expose them to the world. They can live in a nice little cocoon. There's some really cute commercials about dogs in bubbles. I'd love to put Gooey in a bubble. He'd be kind of boring though, and it'd probably be a really slobbery bubble. But that's the idea, is just to protect them and protect their skin. So, the worst thing about having an allergic dog, it's a roller coaster. It's not something we fix. It's not something we take away. It's not something we magically wave a wand and say, oh, poof, all better. The trick is that if you're on that old roller coaster, that do-it-yourself roller coaster, that rickety old thing that you've ridden at Lagoon that shakes as you go, you never know if you're going to live or die. It's rough. That's why we want you on the roller coaster that has our help. We can help you with medications, we can help you with baths, we can help you with schedules and diagnostics to make it as smooth as ride as possible, which is why the Colossus, which is a lot more twisty and turny than that rickety old roller coaster, is not as scary. It takes everybody though. It takes a team. It takes you at home. It takes us in the office. But I'll tell you, the best part of having an itchy dog, Stella's a great example. They love people. They want nothing more than to be touched and rubbed and loved on. She's an itchy dog and she's over there begging for loves. So there are underlying diseases that can cause itch and that can make itch worse. I touched on thyroid disease, Cushing's disease. We also once in a while will run across a behavioral itcher. I have a little patient who's sometimes called Libby. She knows that when one dad watches her, if she's running her little foot, he'll go over and pay attention and talk to her. When her other dad's watching her, she never itches. So it took hiding around a corner and watching her go, oh, there's one dad. And then have her stop when he walked away to realize that she was doing it for attention. They can outsmart us. So it's definitely something where you have to watch for these strange little nuances that dogs that are smarter than us can train us to do. Pain. So a lot of people will associate that really licky, chewing on themselves with itch alone. But part of doing an amazing physical exam, and a huge part of all of this, is making sure there's not painful spots. If one of your dogs walks in and it's licking over its wrist, you better bet we're going to check that wrist too. We're not only going to look at its skin, but we're going to look at everything and take your dog into account, the whole picture. Because there are dogs that seem itchy that really aren't itchy, they're painful. And then there's some autoimmune diseases where the immune system starts to attack layers of the skin or components to their body that can cause itch. Now usually that itch is caused by the secondary infections that go along with it. But this is part of the reason we do cytology and biopsies to figure it out. So what do we do now? Schedule an appointment. Because you're not going to ride the roller coaster alone. It's not fun, it's difficult, and we have so many ways to help you out. So a history is huge. It's the biggest part of this whole thing. The physical exam is the second most part. But come prepared to make a plan together. Because it's not about us just writing a prescription and fixing a little problem. This is about everyone working together to solve your kiddo's itch. And that's my happy dog when his itch is controlled. Tell me what kinds of questions you guys have.
After I play with Gandalf, not necessarily outside, it can be inside, but he'll start licking his paws and stuff. Is that pain, maybe, from sliding on carpets and stuff like that, or is that something I should be worried about?
That's a great question. So Gandhi specifically I know is a player, and he plays really hard. I'd be interested to see actually it in action and have you shoot us a video of what he's doing and see if it's a soothing behavior or a distracting behavior. In that case, we'd really check his joints and make sure there's nothing that we can find painful, or even possibly take an x-ray to check it out. And then we might treat for pain and see what he does. But we all really want to look up inside the parts of his foot after he's done it as well and make sure there's nothing abnormal. Anything else to add?
Wipe his feet down when he comes in from wherever he's been before he starts licking, or when you see him licking. Get a cool washcloth, wipe him down, and see if it makes it go away. Because if it's allergens on his feet, I think that's a legit reason to be itchy.
Yeah, it's mostly, he comes to work with me all the time. So it's normally after our customer's been throwing the ball and he's been sliding on the carpets and stuff like that. So I just thought maybe it was, you said
Car oil.
a car oil. Carpet oil. Let's add the pet part.
Yeah. So she developed it was induced by the owner's over-administration of medication, that she got her body had pretty much an overdose of prednisone. And so she formed little calcium lesions in her skin. She got kind of a round belly. Her skin thinned out. She drank a lot. She wasn't very happy.
I've also had patients just on long-term prednisone use, not even high dose, that have developed very similar lesions. So that's lots of times if we use prednisone, we're using it for shorter periods of time to get things under control. And then we're switching to some of these other products for longer-term management because of the less side effects. So you're not worrying about those things quite as much.
Yeah. And reality is we'd love to get everybody off medications with the rinses and the baths and the wipes and the fish oils and the topicals. But there are times you have to. And if you don't get in front of the itch, they won't get better. But Dr. Pam's right. There are times you have to resort to drugs.
Fun. Okay, so you guys, I have a little white schnauzer, Foster, who's in my office. And she has, she's allergic to food, but she's a schnauzer. So she gets these little schnauzer comedones. Does anybody in here have a schnauzer, a little gray dog? I know, I actually admit that I have a schnauzer now. So they get these little pimples on their back, and we don't really know what they're from. We think it's a food allergy. And I ended up putting her on a food called Derm Defense, which is specifically for dermatologic conditions, but not for food allergies. It's for dogs who have... What it's like fish oils and fatty acids galore. And she, since the first week that I put her on Derm Defense, she has not had a single comedone on her back. And so that's almost 2 years now. So don't overlook the idea of food. And I just want to put a plug in here. I know this sounds like a ton of checks and rechecks. I should stand up so you can see me. Checks and rechecks and checks and rechecks and come back in and see your veterinarian and pay and pay and pay. This is a really great time to use telemedicine. So if you don't know it, you can go on our website, click on make an appointment, drop down box, make a telemedicine appointment, or make an in-person appointment. Obviously, your first visit in, you're not going to do a telemedicine appointment because we need to do skin scrapes. We need to have our hands on that dog. We need to do bacterial swabs and cytologies. But after that, for rechecks, it's really a great time to use telemedicine, and it's more convenient, and it's, I think, cost-effective compared to coming into the office every week for the next 10 years of your life. Sorry.
And you can wear your pajamas.
Unless we're doing a Zoom video. But you can upload pictures and videos and that kind of thing.
After there are skin issues, like an open sore or something like that. Are there any of these things that you talked about that can be spread from one dog to another?
So there are some bacteria that can go from surface to surface for sure. It's really uncommon for them to do that unless there's an open sore on the other dog as well. Although it is possible, and it's also possible with humans. So we did have a patient that contracted MRSA from its owner because he had an open knee incision. And that was treatable, luckily. I mean, we cultured it and figured it out, but they can pass back and forth. So that's why culture is definitely warranted.
The Sarcoptes mite, too, can spread between other pets, and then ringworm lesions as well. And lice. Yeah. So a few of the parasites, yeah, the bugs, yeah. And then the fungus.
You guys talk about the ear dogs and most of the dogs right now, but are you treating the ear dog or the dog? I can talk about it really just fast. You guys, so this is a really interesting case. So we got a yellow lab in. He was day boarding or day day trading. He was day boarding here at the dog park. He was a day trader. And he got a nick on his ear. And so Dr. Steph pulled him into the office to look at his nick on his ear and found an ear infection. And she asked the owner, she said, so talk to me about this ear infection that he's got. He said, oh, he's just fine. We clean it about once a week, and we give him an antibiotic about once a month. Our vet gives us an antibiotic, and we have to use it. And it goes mostly away, and he's really good for a while, and then it just comes back, and it's really, really bad. They are now on week 12 of antibiotic for MRSA. They could not even get antibiotic into the ear, so they started out with oral antibiotics, oral anti-inflammatories, and they didn't use steroid. They should have probably in the very beginning, but they didn't. And now they're starting to be able to use topicals, but we're on week 12 of oral antibiotic for a nasty resistant MRSA infection with an owner in the house who's been on chemotherapy. So guess what that person's immune system is? Not very good. So who gave it to whom? I have no idea. I don't know if the dog got the MRSA from the owner or the dog is going to give the MRSA to the owner, but one of the other happened or is going to happen. So when we saw the dog, we said, well, if he's been on antibiotics off and on for a year and a half, probably need to culture. And the guy resisted because these are expensive tests. I mean, to do a culture is about $200. It's not something we grab right off the bat because we do that and you'll never come back to us. So, but we did a culture right off the bat in this dog, and they're super, super compliant owners because they've had a vet for a year and a half just handing them antibiotics and saying, this is going to help. And then it doesn't, they either don't go back in for the recheck or they don't get it. They don't get told they need a recheck, and then the really super strong bacteria live and reproduce. You just self-create this little population of super, super resistant bugs. Any questions about that? It's kind of fun. We have all sorts of gross, fun vet stories.
Other questions?
I hate to steal the stage, but one of the things that you mentioned was that as dog owners and cat owners too, we need to be aware of what we're feeding our dogs. And then when something changes in their diet and all of a sudden they get itchy, we need to know that, hey, we changed our diet. We need to let you guys know, because Gandalf, was perfect for 8 years, literally perfect for 8 years. And then all of a sudden we changed his food, and I know that I've always fed him a certain kind of food, and I've always been real poignant about, no grains, no this, no that. And then come to find out that he was allergic to chicken and turkey and white fish and this and that and the other thing. And it was as simple as changing his diet. Yes, we had to get the food allergy test, but I knew, because I was the owner, I saved myself a lot of money because you didn't have to do skin tests and this and that and the other thing. I was adamant about, I changed his diet, and this was the problem. So
Again, history.
Yep.
So
How much is that food allergy test? Now the saliva test? I think it's $400. So it's a $400 test, you guys. It's expensive. But if you have an itchy dog, it will save you money in the long run to find out up front what the problem is.
When you switch a bag of food 6 times, you just paid for your test. You really did. You really did. And I have so many owners that say, I tried this, and then I tried this, and I tried this. And it adds up. Just food is expensive, and we want you to feed something that works for your pet.
And the other thing about foods is they can change ingredients without changing the label for up to 6 months. So be aware of new bags of food, not just new food.
Yeah. It's a really good one.
Shelby?
How accurate is the testing, like the food the allergy testing?
The saliva testing? Super accurate. It is accurate. Yeah. Gene Dodds, you can answer this one. Go ahead. Already going. Gene Dodds is a skin thyroid allergy guru in Southern California. She kind of created blood typing for dogs. She's, I think, known pretty much worldwide as one of the leaders in diagnostic testing for dogs. So it's her food allergy test. It's proprietary. Nobody else does it. If you ask a dermatologist, they'll say, don't go to Gene Dodds and get a saliva test. They'll say, come to us and get skin testing, so the patch where they do 72 dots of different allergens, and a blood test. And to do blood testing and skin testing is fine, but if we suspect a food allergy, go right to the food allergy test. if we don't suspect a food allergy, certainly you can go to the dermatologist and have those two done together, which is the gold standard, or you can do the blood test at one time and then the skin test at another. But together at the dermatology office, I think they're hitting close to $2,000 for those two tests together. So, I mean, we try as your local family veterinarians to say, here's what's cost effective. Here's what I would do first if this was my dog. Here's what I would do second, and here's what I would do third. And then try and help you figure out how to do it.
Yeah, and it's even more than 2,000 because you have the skin test, you have the blood test, and then they want to do a food trial. Yeah.
No, and that's not even including the drops. So that's just to figure out what's happening, and then they formulate the drops too.
But you can see why it's tempting to just throw money at the symptoms. So steroids and Apoquel and Atopica or any whatever topical drug, because it's expensive to test and treat. But over the life of your dog, you're way better off testing and finding out the answer as early as possible.
Yeah. And how old was Goo when you diagnosed him?
He was 11 months when I got him.
Yeah, and how old is he now?
12.
So, I mean, that's so many years of better itch control where he's a happier dog. And then that's 11 years where you weren't frustrated every day trying to figure out, why is this dog itching himself to death? It's so frustrating.
It's true. Made me cry. Any other questions?
Do dogs get hot spots?
So hot spots are a great question. So they are typically moisture trapped against the skin that'll cause a secondary infection. Sometimes it's related to allergies, sometimes it's related to skin, other skin diseases, sometimes it's related to ear infections. It tends to be in places where the hair is really thick and moisture can get trapped. So taking samples off of those and seeing if they're bacteria or yeast and what organism we suspect, and then if they're recurrent, culturing them. But absolutely, they need to be open, clean, and to the air so that the air can kill off a lot of the surface organisms, but they do definitely get hot spots. Ugly little things. I'm sure you shave a lot of them, right?
So what is the difference between like an ear infection and a yeast infection? Because I see a lot of yeast infections in the ear, and it's hard to tell. Like, I mean, it's easy for me to tell the difference, but like, what do I tell like a owner?
So it's not easy for me because, yeah, so yeast infections and ear infections, when I was a technician, I used to think, oh, I can smell the difference. They smell totally different. And then we started being smart about it and taking samples out of their ear and smearing it out under the microscope, and I can tell you I was wrong at least 30 or 40% of the time. And most of the time there's bacteria and yeast, and depending on the shape of bacteria we see, it totally changes the treatment plan. So it is really rare to have yeast by itself, but there are cases. But I'll tell you, I have been fooled so many times where I'll be like, oh, that smells like a beer. Totally wrong. It was bacteria. Like, they do. Yeast is supposed to smell like beers. But, you know, without samples out of that ear and looking at it, it's a guessing game. I wish I had that crystal ball. I'd be a lot richer. What is it?
And I think too, doing the ear, because we've started doing ear cytologies more and more, I feel like we're getting a lot better resolution of these ear infections rather than seeing these ear infections linger for months and months and months, or just have these dogs where, I mean, we see them every 2 or 3 months because their ears are causing problems. Once we can get to the bottom of why is this ear itchy, then we know how can we prevent this in the future a little bit better too.
And there are great products out there. There are enzyme-based products that work really well for prevention, where the enzyme breaks down the bacteria and the yeast, so we don't have to use heavy-hitting drugs. But a lot of the solutions we're finding that are sold over the counter can actually be really drying to the ear. And then you go back to that great old debate, do we pluck ears, do we not pluck ears? It really is case dependent because some dogs do really well with their ears plucked and some don't. So I think even the derm community is kind of going back and forth about whether or not to do that or not. And we've just found that it's really patient by patient.
So Shelby is a groomer, which is why she sees lots of lice and lots of ear infections and crazy stuff. So I'm not discounting that you can smell yeast because almost every ear infection out there is some combination of yeast and bacteria. And what we're looking for on the slide is Is it 90% yeast and 10% bacteria? Because if so, we'll treat them both. Regardless, we're probably going to treat them both unless we find just predominantly bacteria. But you as a groomer, the best thing you can do is use a cotton ball and alcohol. Is it an alcohol vinegar 50-50 mix, and just swab them out gently, hand the owner that black globby cotton ball and say, go take this to your vet and get your dog checked. Because honestly, all the cleaning in the world, I would say better than 75% of the time, you're not going to make it go away. And an ear infection only takes, I don't know, how long would you say? No, I mean to blow an eardrum is what I was going with. Maybe 30 days for an eardrum to go from the size of a McDonald's straw on the outside, and when we put our cone in, it looks like a coffee straw on the inside. We can't get past where the vertical canal changes to the horizontal canal. And once it gets that stenotic, we're screwed. Like, there is nothing we can do except oral drugs. That's why this yellow lab that we see is in so much trouble. And so you guys as groomers, I mean, really and truly, it's really, really important to say, this is in your dog's ear, this is causing inflammation, get it to your vet, because I am a groomer and I can do the best to make it smell really good today, but in 3 days it's going to stink again. And in 30 days, your dog is going to be deaf.
Once they get stenosis of their ear canal, or they have the inner or middle ear that's affected, you can have permanent hearing damage. Permanent. We can treat the infection, we can get the itch under control, but once that hearing is gone, there is a chance that it could not come back. So I think being aggressive with figuring these out is really important.
I'll give you one last really interesting story. I think it is. You can tell me to shut up if it's not. So my own personal dog when I was in veterinary, my mom's personal dog when I was in veterinary school was a dog named Brubaker, and he was a big floppy-eared German Drothar. And he had recurrent ear infections, and he would lie in puppy timeout before we called it puppy timeout. And my mom would have her little cleaning kit, and she would scoop him out and clean him out, and everything was great. And one day I had a veterinarian over at my trailer in Colorado, and she said, God, my mom was there, your dog's ears just reek. And I said, I know, it's something my mom deals with. She cleans them. They're just yeast. It's no big deal. And this vet said, this dog has middle ear infection. And I said, how do you know? And he said, well, how long have you been treating? And I said, well, he's 11. And he's like, okay, so this has been his whole life. And she said, you ought to let me do, and at the time we didn't do CT scans, but I took him into the derm department, and they recommended bilateral ear canal ablations. What that means is take out the entire ear canal apparatus, including the tympanic bulla, including scooping out the bulla, which is the bony encasement that holds the air that makes your dog hear. So it's right behind your eardrum. And I will never forget it. Dr. Edwards did the surgery. I went in and watched as he used this little spoon. It's called a curette. It's a spoon, an ice cream scoop, and did this around the tympanic bulla and pulled out wads of this the black crap that you see in the external canal had broken through the eardrum and gone in and grown into the middle ear. And then the eardrum would seal over, and then it would come rupturing out again, and my mom would clean it, and then it would close back over again. So at 11 years old, we did Brubaker surgery, bilateral total ear canal ablation. Can't even remember how much that cost. Luckily, my parents paid for it. And I was a baby vet. I took him home. We didn't do very well with pain control then. And he lived another 4.5 years as a totally different dog. Totally deaf, but happy, bouncy, completely different. And my mom said to me at least 50 times, if she was here tonight, she would probably cry and say, I can't believe I tortured that dog for 11 years, because we just didn't know. I mean, I was a baby vet student, and our vet was Dr. Dankers, who's a great guy. But, you know, that back then we didn't culture. We didn't go look for what the cause was. And in his case, it was probably some sort of allergy that predisposed him to his infections that just got worse and worse and worse. So it's pretty important to know whether you're dealing with allergies or bacteria, yeast, bugs, disease. Thanks, Dr. Kara. You're a rock star. That was a great presentation.
Thank you guys for coming.
And you guys, we really appreciate you all coming. Oh, this cute Airedale thought we were all clapping for him, which we are. If you liked it, will you please go online on Facebook where you saw that this was happening and just make a comment? We really want people to know that the Utah Dog Park and Animal Care Center are really not just places to suck your money dry or drop your dog off so you can go have a life. We're really kind of all into this for the betterment of you and your pet, and we like to educate, and we like to see you all.
Next month's seminar, we're going to have one of our trainers that's going to come in and talk about body language, how to read canine body language, and you can and we're going to bring in some examples so that way you can watch pets in person too. We hope to see you there. And it's the first Tuesday of every month, starting at 6:30 for our yappy hour, and then the presentation will start at 7.